anybody? No, thank you. Item number 3 is the approval of the updated Liverpool Outbreak Management Plan. It's 9 months since the publication of Liverpool's COVID-19 Outbreak Management Plan, which outlined how we would work together to use local knowledge and information to prevent and control the spread of coronavirus in Liverpool and to protect the health both of individuals and our communities. The updated plan, which is on pages 1 to 29 of the agenda today, outlines how the system will work together, taking into account local priorities, risks, and addressing inequalities, utilising the learning from the past year. Can I invite Matt Ashton, our Director of Public Health, please, to introduce the report?
Thank you, Chair. So, as you said, it's 9 months since we published the original Outbreak Management Plan. We published it last June, and since then, obviously, we've been responding to COVID pandemic right the way through, and we've learned a lot during that during the last 9 months. So it's absolutely right and timely that we should update the Outbreak Management Plan. We've been working really well as a system together to tackle the pandemic, and I'd like to pay tribute to all of our partners for working with us so well on this, and through the Health Protection Board, which has been one of the main ways we've coordinated the response against the pandemic. And so, if you like, this is the Outbreak Management Plan that sits at the Health Protection Board, which feeds into the Health and Wellbeing Board. I'm just going to ask Emma to take us through a few of the key points of the Outbreak Management Plan so everybody's clear on what it covers. And then, of course, happy to cover any of the sections in any detail if there's any questions. Thank you, Chair.
Thanks, Matt. Emma?
Okay, thank you. So this is the plan for the next phase of our response. As more of the population is vaccinated, we increasingly expect to be dealing with local outbreaks, and our biggest challenges will be tackling variants of concern and any pockets of enduring transmission. This plan doesn't sit alone. There obviously it builds on well-established plans across the health protection and emergency plans across the system and of individual organisations. The plan goes through how our surveillance, how we will use all of our sources of intelligence from across the system to identify at an early stage any issues and problems that we need to respond to. There's a big emphasis on information sharing. There is an enhanced surveillance for variants of concern, with a particular concern at the moment around the South African variant on an international and national basis. And we will use our intelligence to respond very quickly if that becomes an issue locally. The plan covers actions to slow the spread of infection. And our communications plan, and really importantly, how we engage with our community. It covers how we tackle inequalities. This is a theme that's running throughout the plan. It covers compliance and enforcement, and symptomatic and asymptomatic testing, contact tracing, how we support people to self-isolate, how we will respond to local outbreaks, and it goes into detail about arrangements for particular complex settings, including care homes and prisons, and also the arrangements for schools and the student population. There's quite a detailed plan included here on our vaccination programme, and with a particular emphasis on how we address any inequalities in vaccination. And then just to there's the plan will be there's also a section on activities to enable living with COVID, so how we can open up social and economic life safely. And then, really importantly, our commitment to continuing to learn lessons and update the outbreak plan. So the plan is obviously currently in draft form. So there's an opportunity for comments and input from the Health and Wellbeing Board. And when it's at the point when it's approved, the plan, we intend to continue to update it regularly on a monthly basis, and taking into account lessons we've learned through an ongoing debriefing process. So happy to take any questions or comments about individual sections. I know there are minor formatting issues, which obviously we'll tidy up before it's published.
Thanks, Emma. Are there any questions or comments from partners? Richard?
Thank you, Chair. Can I take this in two parts? A lot of this report is assuming an intelligent response from Public Health England and a strong interaction between the Council, the NHS, track and trace, etc. And I just wanted to let you know that yesterday afternoon, the office holders at the Local Government Association had what I can only describe as a dire meeting with a senior official from NHS England based in Leeds, telling us about what was happening to the two new bodies being set up. And it's quite clear that for the next 8 to 9 months, they're going to be rearranging the deck chairs on the Titanic in terms of what they're going to do with the boards, the senior management teams, and the flow through from that. And they also announced a new name for PH England, which wasn't the new name they announced 6 months ago, but I can't remember what that was. So the upshot of that, which leads me into my local considerations, is how we're going to operate within an environment where PHE are going to clearly have prescribed decision-making processes, where they're still clinging on to things like elements of the vaccination programme, which has worked because the NHS has run it, but track and trace, which hasn't worked, in my view, largely because Serco have run it. The only reason it's worked in places like Liverpool is because we've got it going. And when we were pressing away, because we then moved to the role of public health within the integrated care systems, they were able to give no assurances about the role of public health, in our case, across this Cheshire, Liverpool City region, huge area. And although we've had reassurances from ministers about appropriate local engagement, we weren't getting it. So I think this needs us to back up this report, which I have no quibble with at all, with some action, both by officers through ADPH, etc., and us supporting the LGA. But that leads me to two quite specific questions based on this report. This report covers 9 months, and my fear at the moment is that whilst everyone on this call has a clear understanding that COVID is probably going to be with us forever, up and down, worse and better, in the way that flu has been, I don't know, for forever. There's no understanding that at some stage all the brakes won't come off or shouldn't come off. So how are we, as far as our city is concerned, going to start preparing our businesses and our consumers, our people, not for the 9 months, but for the longer term, to say we might always have to do things differently to prevent flares and reoccurrences, and how much of that is relevant in the light of a track and trace system, which at some stage nationally they'll have to call off, and a NAP, which for most people doesn't seem to have worked. So I'm sorry that rambled a bit, because I was trying to give some information as well, but I'm seriously concerned now about our interactions with PHE or whatever its successor is going to be called. Thanks, Chair.
Thanks, Richard. Matt?
Thank you, and thank you, Richard, for your comments. So, absolutely, there are changes happening to Public Health England as the national organisation. The new name is the UK Health Security Agency. UCSA is the acronym, but I'm not sure how sticky UCSA is going to be. So UK Health Security Agency, and absolutely, those plans are still emerging right now, and we are not clear what that will look like on a local and regional level. We think it will be a northwest footprint with interactions probably across Cheshire and Merseyside, but it is still emerging. However, what I would say is, right the way through this pandemic at a local level, our relationship with Public Health England and with some of the excellent local officers they've got has been great at a local level, fully engaged, fully supporting us in this pandemic response, as have the wider partners who are represented on at the Health and Wellbeing Board and at the Health Protection Board. So at a local level, we absolutely have worked as a system together. In relation to the second point, just really briefly, yeah, absolutely, COVID is likely to become an endemic disease, and we're not entirely clear what that path is going to look like. What we are doing locally is not just putting plans in place for the next month. We're putting plans in place to cover us at least until March 2022, particularly around contact tracing, enhanced contact tracing and outbreak management, to allow us to deal with those local flare-ups. But as Emma said when she was covering the outbreak management plan, we will need to keep on refreshing the outbreak management plan to update it in relation to the changing context and what that looks like locally. I think Tony, I would also say Tony and I work closely with the business sector in the city as well, to keep them very informed and very updated as to how the pandemic is going, how it affects them, and how we can support them through that. And I'm sure we will continue to do that. Thank you.
Thanks, Matt. Any other points or comments from the report? Yeah, Fiona?
Thank you. I'd just like to support Matt's comments really about how well we've worked together as a system. It's felt really good, and I think it's really helped us, particularly from a vaccination perspective. It's really helping me as clinical lead for the vaccination programme to have the support of the council. On the vaccination programme and the details that are in the report, I would just add that the vaccination programme and our plan is very much live and changes and flexes continuously based on ever-changing national policy, but also responding to the local needs. And so even as it's written, it's almost out of date, because we continue to respond to the local picture. So the map that's in there, for example, doesn't currently, at a glance, it would look like there are big parts of the city that have got gaps in them. But actually, if you look at our satellite sites, those gaps are not as big as they look. So I just wanted to point that out. Thank you, Chair.
Thank you, Fiona. Any other questions or comments? No? Well, can I formally move that the updated Liverpool COVID-19 Outbreak Management Plan be approved?
Agreed.
Agreed by everybody? I can see no dissent. Yeah, thank you. And that concludes the business for today's board. And can I thank you all for attending and those who are observing online, and formally close the meeting. Thank you.
Thank you.
Thank you.